child is going to get a lot of coughs and colds over the first year of life. Even into childhood, they're going to get a lot of coughs and colds. So let's review some points that's going to help keep your child safe and how to make your child feel a little bit better. So colds and coughs and runny noses, they're caused by viruses. And on average, a child's going to get about 7 coughs or colds over the first year of life. Somewhere it's upwards of sometimes 30 infections, though, by the time they're 3 years of age. As a child, you want to be sick because these coughs and colds that your child is going to fight off and have no problems with, these would put us into bed for about a week or so.
You do much better as a child than you do as an adult with these.
You really want to be sick. It's a child's job to get sick because you want to develop a good immune system so that you're not sick when you're an older person. Symptoms of a cough and cold are what we typically see, right? The cough, the runny nose, the congestion, and it's usually associated with some type of low-grade fever. Now, colds, runny noses, coughs, they're all caused by viruses. And we've said that antibiotics do not help viruses.
They don't. It's
antibiotics,
tempting.
Right. Antibiotics
They
don't help viruses, therefore they're not going to help coughs and colds.
And they have side effects, so you don't want to give them willy-nilly and something that's not going to have a benefit.
Right, exactly. And these over-the-counter cough and cold medications, the Food and Drug Administration have actually not really recommended or banned them for children that are less than 4 years of age. They don't help, and some kids have actually been harmed from them. So cough, cold medications, don't use them. They just don't work.
They don't. Now, there are things that do work. If you have a child with a cough and they're over the age of 1, you can consider a half a teaspoon of honey. It's like magic. It makes sure, like children aged about 2 to 5, just take a half a teaspoon of honey. Children love honey. It's smooth, it tastes sweet, it's wonderful, and it does calm their cough. Now again, remember, not under the age of 1. There's a risk of a condition called infant botulism. Don't give it to your child under the age of 1, but from 2 up, go ahead, use a half a teaspoon of honey. It's magic. It makes their cough go away. And then babies, particularly little tiny babies, they're what we call obligate nasal breathers, meaning that they have to breathe through their nose. They don't yet know how to breathe through their mouths. So when their nose is stuffed up and they're trying to nurse or they're trying to feed from a bottle, they have to choose between breathing and eating, and they'll choose breathing over eating. So if you want to clean out that cute little nose and get the sort of boogers out of there and all that sort of nasal discharge out of there, what you can do is use that syringe. Often they send you home from the hospital with the little bulb syringe. You can use that to suck out some of those boogers that are down there, and you can also use a little bit of a salt solution. You can buy it at the store. You can just talk to the pharmacist and say, I need to have a little bit of those salt drops for my baby's nose, and they'll give you those salt drops, but you can make them at home as well. Now you want to use the right proportions of things and the right things to make it, because think about it, when you were in the ocean and you actually got some salt water up your nose, it burns. So you want to use the right proportion, and what you want to use is not the kind of salt that you use in your salt shaker. You want to use either sea salt or kosher salt or canning salt, and you want to use about a half a teaspoon to a teaspoon in a cup of warm water, preferably water that you have boiled that's now cooler. So a cup of warm water, and then just put a pinch of baking soda in there. The baking soda takes that burn away. You can put a drop in the nostril, suction it out with that little bulb syringe, try the other nostril, suction that one out. Your baby will feel so much better. You don't need those over-the-counter medicines that you're not supposed to give anyway. And a little bit of honey if they're older kids. Suctioning out the nose in the little kids takes care of a lot of the symptoms that children have with colds.
Exactly. Now, how do you protect your child from coughs and colds? How do you not spread it to other people? Remember, colds are viruses, and they're very easily spread from person to person. Every time someone coughs or sneezes, they're basically releasing all these virus particles into the air. If someone coughs into their hands and then touches a glass or a doorknob or an escalator handle in a mall, that's going to transmit viruses to other people. So what can you tell your children in order to keep them more healthy? Well, the first is to encourage them to wash their hands a lot or use those disinfecting gels. Having a jar of that or a bottle of that in your car every time your child goes out to some public event, whether it's a supermarket and they're touching things or the mall or the zoo.
Keep the little container on your person. Throw it in your purse, put it in your pocket.
Exactly.
Lots of little portable ones.
Wash their hands a lot and use this gel. When they're coughing, it's very important that you teach them to cover their mouth. Now, we used to cough into our mouth, and all that did was spread viruses to everybody else.
My mother told me, cover your mouth when you sneeze, cover your mouth when you cough. Well,
the new teaching is to actually cough into the elbow. It's kind of like a vampire or a Dracula. So if you teach kids to cough this way, it's keeping their hands clean, but at the same time, it's preventing those virus particles from going out into the community, into the air. Now, viruses actually can live on household surfaces. So if somebody does cough or does sneeze or does touch a countertop at your house, those viruses can actually live for a few hours. So you might want to consider getting some type of antibacterial kind of cleanser solution, things like Lysol or Mr. Clean, and that will help disinfect your countertops. And again, your children are less likely to get sick.
That works very well. And if you're traveling, when you go to places like hotels, the things to look at are your remote control for the television, wipe that down, the telephones themselves, and anywhere around a keyboard, because we use keyboards so often. Those are also things to just gently, don't get wet your keyboard, but wipe off to get the viruses that may be living there that were deposited there a little while ago.
Right, exactly.